Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. In the last class, we are discussing about the present complaints. In the present complaints, we have completed two important portions. One is onset and another one is progression. Now, the third point in the analysis of the present history is severity. Now, when each symptom is there, you have to identify the severity of that particular symptom. Suppose the patient is having fever, that fever may be mild, that fever may be moderate, or severe fever may be severely severe. Okay, so now how you identify whether it's a mild, moderate, or severe? That is depending upon the activity level and comfort level of the patient. If the fever is there, but that along with that fever, patient is able to do the day-to-day activities without any much exertion, and patient is able to take the food, patient is able to do its day-to-day activities without any dependency, so then it is called as mild fever. If the same has been done with some assistance and patient is sick looking and patient is always like to reside in the bed or take the rest, then the fever is moderate. Another is if the patient is not able to get up from the bed and everything has to be served to the bed and is totally bedridden, then it is called as severe. Okay, so severity is one of the very important issues in each and every symptom. Suppose if you take the pain is tolerable, then it is mild. Pain is not much tolerable and it wants some medications, moderate. Patient is rolling over the bed, as in case of renal colic, then it is severe. Now, in the severity, we have to look into two important parts. Severity at the time of the attack and severity in between. Suppose the fever is there and you have to also look into interfebrile period. What is the comfort level of the patient during the fever and what is the comfort level of the patient when there is no fever? As in case of viral fever, usually the child is playful in the interfebrile period. Whereas in case of bacterial fever, even in the interfebrile period, when the fever is not there, the patient is very dull and sick looking, or child is very dull and sick looking. So severity during the time of the complaint, presence of the complaints, and the severity during the absence of the presence of the complaint. Okay, when pain is there, how he feel? When pain is not there, how he feel? Okay, that when fever is there, how he feel? When the fever is not there, how he feel? That has to be also taken. Okay, so usually what happens in children is a sick looking child and a playful child. These are the two important criteria to assess the severity. Okay, the child is sick looking and child is not sick looking. For example, fever may be there up to 102, but still the child is playing. Okay, so we say that the severity of the fever is not much. If the fever is only 100 degree and the child is totally sick, the severity is more. So therefore, for each and every symptom of the main complaint, when we go for the analysis, along with the onset, progression, and now comes the severity, that has to be taken. So if I take a simple example of fever, the fever is of acute onset and fever is gradually progressing and patient is dull and not able to do its day-to-day activities without assistance. So this is how you have to write. Okay, so this is the importance of severity. Now another important analysis point in the present history is the character and nature. Okay, every symptom has got its own nature or character. Now if I talk about fever, the fever has got its character. Like fever may be a continuous fever, fever may be a intermittent fever, fever may be a remittent fever, fever may be an episodic fever, fever may be an irregular fever, or fever may be an erotic fever, that means not following any of the rules. Or sometimes fever may be evening rest temperature, fever may be night rest temperature, fever may be of step ladder pattern. So like this, we have got different character of the fever or nature of the fever or type of the fever. Similarly, if you take the pain, we have got different character of the pain like burning pain, throbbing pain, or pulsating pain, dull ache pain, or there may be squeezing pain, or there may be colicky pain, or there may be burning pain. So like this, if you take the vomiting, for the vomiting again we have got the vomiting, the character is it may be a projectile vomiting, it may be a non-projectile vomiting, it may be a bilious vomiting, it may be a blood mixed vomiting. So like this. Similarly, if you take edema, edema may be a pitting edema, edema may be non-pitting edema, edema may be divabali, edema may be ratribali, as explained in the context of the Shota. Okay, edema increases in the morning hours, edema increases in the evening hours, edema increases in the dependent portion, edema increases in the horizontal position. So like this, we have got different understanding. So therefore, for each and every symptom, there will be a character or nature that has to be written. Now, if you take the example of fever, fever is of acute onset, fever is gradually increasing, and it is so severe that patient is not able to get up from the bed, and the nature of the fever is continuous. And it is a continuous fever. So now we have gathered a lot of information in very few words. That is called as beautiful history. History taking should be always precise, short, and to the point. There should not be unnecessary points. Now, although we have mentioned only 4 words, we have gathered maximum information. Fever is of acute onset, gradually increasing, severely severe, and it is of continuous type or continuous nature. Okay, so this is how we have to analyze. Then you go for the next character, that is course. For each and symptom, there will be a course. Now, course and duration. What is the difference between course and duration? See, our total study period is about 20 years, isn't it? Starting from first standard up to your completion of your graduation, BMS graduation, it is 20 years. Now, out of this 20 years of total duration of your study, BAMS is a 6 years course. BMS is a 6 years course. So duration is from the beginning itself. In between comes there is a course. Now, for example, fever. Fever is there for since last 10 days. And when once the fever comes, it will be persisting for 4 hours. Okay. Now, this 4 hours is considered as a course of the fever, one course of the fever. Suppose pain is there since last 10 days or 5 days. And once the pain comes, abdominal pain start, it persists for 15 minutes. After 15 minutes, it subsides by medication or some other methods or spontaneously. Now that 15 minutes is considered as the course of the illness, course of that particular pain symptom. So that is, course is that time period where the one particular episode comes. Okay, so you have to ask the course for each and every symptom. For the fever, we have a course. For the pain, we have a course. For vomiting, how many times it is happening. For the edema, okay, for how many times the edema persists. Okay, once it persists, for how many times it will be there. So for pain, for headache, for everything there is a course. That course has to be written. Okay, this is very important aspect. Another important is aggravating factors and relieving factors. Now, factors which are present, factors because of which the present symptoms will go into aggravate, like doing exercise, food intake, exposure to heat and cold, intake of the milk, empty stomach, etc. So these are considered aggravating factors. The factors or point may make doing which the present symptom will go into aggravate. That is called as aggravating factor. And by doing what the present symptom will go into subside, that is called as a relieving factor. Sometimes fever may subside by taking medicine, fever may subside by taking the hot water, fever may subside by taking rest, fever may subside by taking some of the fluids. Okay, so this is relieving factor. Fever may aggravate by doing the exercise, fever may aggravate by doing some of the household work, fever may aggravate by walking or by exposure to outside. So these are all the aggravating factors. Ulcerative colitis may increase by intake of the milk. Okay, empty stomach may increase the pain in case of peptic ulcer. So these are aggravating and relieving factors. Okay, in case of paranama shula, in case of annadrava shula, okay, in case of pittaja shula. So like this, there are so many aggravating factors and relieving factors that has to be also identified. Now another important is diurnal variation. So whether the present symptom, whether that will go into increase according to the phases of the day. That means morning hours, afternoon hours, evening hours, night hours, early morning hours. The present complaint will go into increase or decrease. Whether there is a variation. So that has to be identified. That has to be identified. There are so many things that in the morning hours fever increases, evening hours there is no fever, or sometimes evening hours fever increases, morning hours there is no fever. Night hours there will be more sweating. In the daytime there is no sweating. Night hours the edema increases and leads to dyspnea. In the daytime there is no problem. Okay, so all these factors are there. So therefore this point has to be also understood. Now actually diurnal variation means what is the symptom relationship with the body and environment. Ayurveda we explain two important things. One is nishpratyanika, another one is sapratyanika. The present symptom, suppose a cough is there. If the cough is going to increase in the morning hour, it is a kapha. Cough is because of kapha if we assume. And morning hour is also kapha pradoshaka, kapha kala. And in the morning hours, if the kapha increases, then it is called as sapratyanika. Okay? But the kapha increases or cough increases during the midday time, it is nishpratyanika. Because midday time is pitta kala. In the pitta kala, the kapha is increasing or aggravating. So now this is nishpratyanika. So therefore, this is how the diurnal variation has to be understood. Okay. Then you have to look into the relationship with the food. So this also we have seen. Then associated symptoms. Now every symptom, main symptom has got associated symptoms. If I have got the fever has got a body ache. Fever may have the loss of appetite. Fever may also have the dullness. Okay, or sometimes fever may have irritation. So these are all associated symptoms. If I have got abdominal pain may have some nausea. Abdominal pain may be associated with the sweating. Abdominal pain may be associated with the loss of appetite, or abdominal pain may be associated with the increased frequency of the stool sometime. Okay, these are all associated symptoms. Now that's important. You have to differentiate between the main complaint, chief complaint, and associated complaint. Okay, so every symptom has got some associated complaints, and associated complaint should not be given much importance or more importance than the main complaint. Okay, so these are some of the important points. So suppose by taking all these things, if I take the history, present history of the fever, in this case, just give an example. Patient was apparently normal 10 days back. Then he started with the fever. The fever is of acute onset. Fever is gradually increasing, and the symptom is fever is so severe that patient is not able to get up from the bed. The fever is of continuous type, or fever is of intermittent type. Fever comes in episodes, or fever comes in episode. Just take fever comes in episodes, and the course of the fever is 5 hours. And fever is aggravated by the exercise, and fever is relieved by the medications. The fever is associated with the body pain and loss of appetite. There is no relationship with the diurnal variations and also food. Finish. This is all the information regarding fever. So along with the fever since last 10 days, patient also started with the abdominal pain since last 5 days. Abdominal pain started suddenly, and the abdominal pain is gradually increasing, and pain is of intermittent to colicky type. Pain is so severe that patient is not able to tolerate and roll over in the bed. The pain is relieved by intake of the milk, and pain is increased by the empty stomach. The pain is associated with the sweating and also nausea. Everything about the fever is over, and pain is not having any diurnal variation. Along with the pain since last 5 days, patient also started with the vomiting. The vomiting is projectile type. Vomiting is of acute onset, gradually decreasing or stable. Vomiting is now stable, and it is of non-projectile type without any bile and blood mixing. Vomiting so severe that vomiting is mild and patient can tolerate. Vomiting has no relationship with the diurnal variations and food intake. Vomiting is aggravated by the intake of the spicy food and decreased by the intake of the milk. And it is not associated with any other complaints. Finish. See how simply, in a minimum words, we have completed the whole history and we have gathered the required information. There is no unwanted information. Everything will going to guide to a correct diagnosis. Otherwise, definitely you will going to miss. Now, this is how we have to take the present history. Okay. So now, these are the basic things that we have to follow for each and every symptom. Then you can able to take a correct history. Okay. Now again, in the case of the fever, some of the additional points we have to consider. Okay, some of the symptoms. For example, along with all these things, when you talk about the fever, in the fever, some of the additional information like trend of the fever, how the fever was on the first day, second day, third day, that has to be taken. It can be taken as the progression of the fever. Then you have to take up the interfebrile period, not it's interfebrile period. What is the how the patient was in the interfebrile period? What is the rhythm of the fever? Okay, what are the episodes, and what is the response to any of the antipyretics? Okay, maybe the baby is sick or playful. So these are some of the additional information that you have to ask along with this. Similarly, in case of the pain, what is the site of the pain? That is important. Okay, these are some of the extra information that has to be asked in some of the symptoms. Site of the pain, and pain may be, again, when you talk about the pain, not only nature of the pain that you have to ask a few more points. What is that? Whether the pain is referring pain, whether the pain is migrating pain, or whether the pain is shifting pain, whether the pain is deep pain, whether the pain is superficial pain. This should be asked. Deep pain, superficial pain, you can confirm it by palpation also. Okay. Now, referring pain, migrating pain, and shifting pain. Okay, this is important. Shifting means once the pain is shifted from one area to another area, it will not again go back to that area. You're just shifting the room in the hostel life. Once you shift the room again, you will not go back to that room. You're fed up of that room. Therefore, you're shifting to another room. Similarly, in case of appendicitis, pain is shifted from the lumbar area to the right iliac area. Okay, so here the pain is shifting. The pain is shifted. What is migrating pain? The birds used to migrate, isn't it? So migrate, they come from other continent, thousands of kilometers away from the away, and after completion of their reproduction, they again go back. Migration means you are connected with the original place. Okay, you are not disconnected. So here also migrating pain means migrating pain means joint pain is there. In case of RHD, rheumatic heart disease, will get it. So joint pain is there in the knee joint, and after some time the knee joint pain is disappeared. The patient start with the pain in the elbow joint. Okay, and after a few months again that pain can start in the knee joint, right knee joint again. So that means this is called migrating. Pain is migrating. Okay. So in other words, referring pain or radiating pain. There is radius means that there is a central point and there is a radius. So from one central point, pain is radiating to the other points. Pain may be radiating to back, pain may be radiating to front, pain may be radiating to the flanks, or pain may be radiating to tip of the shoulder, as in case of cholecystitis. Okay, pain is referring through some nervous connection. There is a connection, radius is there. So these are some of the extra points that you have to ask in case of pain. Site of the pain, then referring pain, migrating pain, or is it a shifting pain, it's a deep pain, or superficial pain. Similarly, in case of swelling, you have to ask whether it's a dependent edema, non-dependent edema, or what is the role of gravitation, effect of gravitation, whether it's a pittig or non-pittig. Okay, so these are some of the extra questions that you have to ask, which you can expertise after experience. And this is the correct way of taking the history. Okay, so this is how we have to analyze the present history. Again, don't forget these 10 important points: onset, progression, severity, course of the fever, nature and character of the fever, aggravating and relieving factors, diurnal variations, then the effect of the foot, associated symptoms, extra information. 10 points. Okay, so with this we conclude. This is all about the present history. I hope today onwards you start taking the present history in this way, and it's a very interesting aspect actually. So you can collect the maximum information and put it in a very few words, because history taking should be precise and short and to the point. Okay, so you have to take like that. For this you have to follow this particular method. Okay, thank you very much. We will again meet in another class. The next class we will discuss about past history. Thank you very much. Don't forget to subscribe my channel, and also please give your valuable comments.